reason I decided to build the Acoustic Neuroma program is the fact that acoustic neuromas, I believe, is probably one of the most challenging tumors, most challenging diagnoses that we face in neurosurgery. So this is a tumor and a group of patients that really requires what we call a multidisciplinary approach. You need a team of experts that just focus on this type of tumor.
At Cedars-Sinai, we are pushing the envelope to improve care for patients with acoustic neuromas. We are studying the stem cells that are derived from acoustic neuromas to identify the cells that both initiate and propagate these tumors, to develop new therapies and to improve therapies that are already present.
We have facial nerve specialists, vestibular specialists, physical therapy, audiologists for specialized testing, and of course neurosurgery as well. And so having all of those pieces to the center makes it both collaborative and a comprehensive care for patients.
As a neurotologist, I know that having a close relation with the neurosurgery department is paramount to success in skull-base surgery. Over the years of being here at Cedars, I'm proud to have worked closely with the neurosurgeons here for many complex skull-base tumors. Without that positive relation, the communication and planning that's critical to success wouldn't have been possible.
So V&G and ABR are just some of the many steps that Cedars-Sinai takes to ensure a successful surgery. Video nystagmography, which is also known as V&G, looks at a patient's vestibular system, which houses their balance mechanism. The auditory brainstem response testing, also known as the ABR, tells us how well the inner ear and the brain pathways for hearing are functioning.
The role a physician specializing in vestibular disorders brings to the team is an expertise that can be very useful, particularly after surgery. There are not many acoustic neuroma centers that have a specific dedicated vestibular specialist. While on the team, I can make sure that your recovery goes as smoothly as possible, and if there are any bumps in the road, I can be there to assist.
As a patient navigator, I understand how overwhelming and complex the healthcare system can be, especially for patients who are already dealing with health concerns. My role is to assist and guide patients through this journey and provide the support and resources that they need to navigate the system with ease. I work closely with the different departments and scheduling teams to arrange appointments that fit the patient's needs and schedules, ensuring that they receive the care they require in a timely manner.
So thankfully, after acoustic neuroma surgery, facial weakness or facial paralysis is actually pretty uncommon. However, it does sometimes occur in patients just due to swelling on the nerve after the surgery. And thankfully, in those cases where there is weakness, it is usually temporary, and there are many different procedures that we can do to kind of help to assist with that recovery.
The typical time frame for recovery after surgery is you will work in the hospital for a couple days, working with a therapist to return to home activities, and then you'll be referred out to myself at an outpatient facility to work with a vestibular therapist on exercises to help improve the strength of your vestibular system. But really 4 to 6 weeks, patients should be feeling pretty much back to normal.